Hello and welcome to AuntMinnieTV. My name is Brian Casey. I'm editor-in-chief of AuntMinnie.com, and we're here at the 2004 edition of the Radiological Society of North America meeting. Every day someone comes up to us and says, where did the term Aunt Minnie come from? Well, we're lucky to have with us today Dr. Maurice Reeder, and he was a colleague of Dr. Ben Felson's from the University of Cincinnati, and Dr. Felson was the one who coined the term Aunt Minnie. Dr. Reeder, thank you for being with us today. So you were a colleague of Dr. Felson's.
Yes, I knew Ben from about 1960 when I was a resident at Walter Reed up until the time of his death in 1989. We collaborated on several important projects, most well-known of which is the Gamuts in Radiology text, which is now in most countries of the world, over 100,000 copies. So yeah, I knew Ben better than most folks.
And you remember when he began using the term Aunt Minnie?
I remember that term as far back as I remember meeting Ben, so I'm sure he was using it in the 1960s. He coined many phrases and terms that we use in radiology today, like the silhouette sign, the Hallam overlay sign, and many other terms, especially in chest radiology. But he was using that term in the 60s.
And what exactly to him did an Aunt Minnie mean?
Well, Aunt Minnie was a way for him to intimate that if you didn't have a logical way of approaching film diagnosis, the triangulation method that he and I and Colonel Thompson and Lee Theris and many others taught for many years of analyzing the film for all the details and nuances, clues. The first step of the triangle. The second leg of the triangle was the gamuts or differential diagnosis. The third leg was clinical information. You put all that together and you can make a diagnosis. If you didn't have a logical way of doing that, then he used the term Aunt Minnie for radiology residents or radiologists who used a different approach. They would recognize or think they recognized an entity based on what they had seen maybe several months or weeks earlier, or similar case. They go to have a party, a reunion, family reunion. You recognize Aunt Minnie because you've seen her before. So this was a way of him saying, well, if you think you've seen a similar case like osteopoikilosis, for example, with multiple tiny densities around the joints of the body in youngsters, then you diagnose it based on your memory of what Aunt Minnie or what that particular case looked like previously. It's again his way of saying that was a different method of approach to diagnostic radiology than the more strict methods that we used to teach.
Now, did he actually have an Aunt Minnie to your knowledge?
I can't answer that with certainty. I knew most of Ben's relatives and family. I spent many long hours with him in Cincinnati and met almost the entire family. I never knew an Aunt Minnie. His wife, Jenny Felson, who's still alive, would probably know the answer better than I. I think it was a term that he just coined out of thin air, like he did in many of the other terms we use in radiology that have significance, have stood the test of time. But I don't believe there ever was a real Aunt Minnie.
All right, Dr. Reeder, thanks for being with us. Signing off for AuntMinnieTV, my name is Brian Casey.